My name is Neetu. I go by the pronouns she, her. My role is to really lead an enterprise-wide strategy for how we can take a diverse workforce and really help to deepen feelings of equity and inclusion. And that's really where the magic lies in terms of attaining a sense of belonging, which is so closely connected to mental health. I was probably in high school when I realized that I'm experiencing some form of anxiety. But what I found through a journey where I can now say I'm almost like friends with my anxiety because I've become more in tune with understanding where it stems from and having more compassion, like more self-compassion for why I am wired the way I am. And sometimes we're not consciously aware of how early life experiences impacted us. And especially if you went through some form of oppression or racism or just discrimination early on, those messages kind of live at a deep level and then they can perpetuate over the course of our lives. There's a stigma, unfortunately, even though it's 2022, that mental illness is this sort of thing to be embarrassed about, or that it means that there's something wrong with you. Somebody with a mental illness or a diagnosis could actually have better mental health than somebody who doesn't have a diagnosis at all. And the reason for that is they are forced in a way to prioritize their mental health. It's so important for team members to be mental health allies for one another. And being a mental health ally comes from understanding that mental health impacts all of us. And just because somebody has a mental health diagnosis, they are not their diagnosis. That's just one part of their experience. The more we understand and have more compassion around mental health, which comes from doing our own work on our own mental well-being, the better we can show up to be mental health allies. And this is especially critical for those who are in a people leadership role, because a people leader can really make or break somebody's sense of inclusion and belonging. So if you have a mental health awareness, or you have a leader who is a mental health ally, that's just going to make them a better leader overall. I would say one of the best things that employers, regardless of the size of your company, can do to be leaders in the space of mental well-being is to actually prioritize this not as just a HR initiative, but start to embed mental well-being throughout the sort of culture of the company. So talk about it, make sure that the senior leadership team, the CEO, the executive team is talking about mental well-being and that they're expressing vulnerability. So when you open up and you talk about your own mental health and you're somebody who's pretty senior at the company, what that's doing is it's creating a safe space. It's normalizing the conversation. It's actively squashing the taboo and the stigma around mental health. Companies that are leading edge in terms of their culture and their sense of belonging are those who require that if you're going to be a people leader and if you're going to lead teams at an organization, that part of your training and your competency has to be around mental health training. So that's not to say you need to become a therapist or a psychologist per se, but you need to be trained in a space enough to recognize work-life balance and to be able to identify when somebody is maybe not at their best self or they're not feeling like themselves on a particular day, and how can we better support team members. It's so important for companies to put their investments around mental well-being if they want to create a sense of belonging. And when people belong, they will give you their absolute best. So it's all very interconnected.